I can show you right now, there's hardly any gap there. I mean, it's completely gone. My name's Dennis, and I've had dental implants for well over a year and a half. It's been an amazing journey. But there were some things when I got my implants that kind of was, I guess, a nuisance at first. With these implants, it takes a little getting used to because you have to use new tools. But it's a lot less work. You know, I use a water pick and I just kind of pick underneath between the gums and the arches, and I just pick water in there, and then I swish a lot. You know, even if I'm out to eat or I'm in the car or whatever, I'm always swishing water. And then I use a really fine wheat straw, I guess, toothbrush. They're really soft. And I can get like onto my gums and on the arch and stuff and just kind of brush lightly, and that's it. So the maintenance is very, very low compared to having to floss in and out of each gap of your tooth and being careful because you're going to make your gums bleed, and you know, the brushing and the, you know, I had an electric brush and I'd have to brush it in and out and over here. And then I had the flipper and I'd have to clean the flipper. And there was a lot of work involved. Now it's just water picking, swishing, I can get a floss in there, move that around in there. And then what, every 6 months I got to go get it professionally cleaned, which they used to have to shoot me up with Novocaine to clean my teeth before. Now I don't need any of that stuff. So it's pretty amazing. Things I had too were gaps, you know, between my gums and my teeth, and food would get in there, and I'd pick it out, or water pick it out, or floss it out, or whatever. And it got to be kind of a pain in the butt, you know, because with soft food, just gets right up in there. And I was always worried that food would be up there and it would cause problems or infections or whatever, but it never really did. It was just kind of a nuisance. Just water picking and learning how to clean them and thinking about how bad it used to be to what I'm dealing with now. Oh, I got a little food between my tooth or my arch and my gums. You know, it's not that big of a deal. You know, you need your gums recede, and your doctor doesn't know how your gums are going to heal. So they make the arch to your gums, and then when they recede, they go in and fix them in the 4 month. I mean, I can show you right now, there's hardly any gap there. I mean, it's completely gone. And there's no lisp, and I don't bite my tongue anymore. So it's all gone. So all those things I was worrying about going through it, they're all gone. And I worked them out myself. But any new patients, you have any of those problems, you go to the Smile Maker page, it's all right there. Or you ask any of the patients and they'll tell you. Or you make a post, hey, I have this really bad lisp, how do I get rid of it? You'll have over 100 comments on how to help yourself. So it's there for you. All the information, anything you go through is there. You know, everyone's so scared of this soft food diet, and really soft food is I mean, you can eat fish and pasta and all these things. It's really not that much. If you cut out steak or beef jerky and chips, you pretty much have a soft food diet. I mean, there's not a lot, you know, that you're taking away from yourself. So you don't have to sit there and drink protein drinks for 4 months. Your brain has to retrain, and it has to relearn what's in your mouth and how to eat and how to talk. So it just took a lot of time, and I found, you know, chewing with my lips closed prevented me from biting my lip. So yeah, there's things that will come up and they'll bother you, but there's an option into changing that, and there's an option to fixing that. And that's where, you know, Smile Maker Club comes in really well. You can just look up biting lip, search it, and you'll find people posting about it and how to stop it, or lisps. There's tons of lisp posts. So you just search it and it'll come up. And there's plenty of different things. People talk about singing in the shower and reading out loud, saying your ABCs, saying nursery rhymes. You know, there's just a lot of things. There's a lot of ways to fix these things. Implants were always in the back of my mind, but you always hear the horror stories, and it's just horror stories. And to have implants done, it was always told that, you know, you'd have to wait like 6 months to a year to get teeth in. So I always just pictured myself walking around toothless and not having any teeth for 6 months or a year. I couldn't do that. My anxiety would just not let me have that. So it was always in the back of my mind, and I just never thought I could just pull it off. Here comes Nuvia, pops up in my algorithm. And the first, the title says, teeth in a day, 24 hours. And I was instantly attracted. It was like a moth to light, it was just like, oh my goodness, what? 24 hours? I've had so many procedures, and I've spent thousands upon thousands of dollars just patching my teeth and fixing my teeth and reconstructing my teeth. Why not just pay it all and just be done and make that, I paid a little bit of cash. I had some savings. Put that down, and I make payments, and I financed it. And knowing that I'm doing this for myself, it just makes everything better. Knowing that I don't ever have to step foot into those dentist office again and hear those drills again and pay those people the exorbitant amount of money to fix my teeth, and then have to fix them again, and then have to fix them again, and just all that reconstruction and pain and money it was incredible, the amount of money I've spent on dental work, and I was going to spend. Now I don't have to worry about that. I paid all in lump sum, it's done. I make my payments, and it's over. Like, I don't have to deal with worrying about that anymore. I know how much I have to pay. And you just go through your surgery, wake up, go back to Nuvia, and have a new smile. You don't even have time to really think about what just happened. Like, your teeth just got pulled, you had implants put in, and within that time, you go home, you sleep, you wake up, you're going back, and you're getting a new smile like that. Like, it's like, how is that even happening? It's amazing. I'm a new person in 24 hours. I go from an old dentist to new dentist in 24 hours, and my whole life changed in 24 hours. So how do you put a price on that? I used to get really bad migraines, and those are gone. I haven't had one since. So it's not only cosmetically looks great, but it does internal things too, as far as your health and your body. What I would say to somebody who is actually thinking about doing this is there's no option. My only regret from doing this is not doing it sooner. And I've been over a year and a half, and I'm still improving. I'm still getting happier. I'm still liking my teeth every day more and more. It's the more you get used to it, the more it's not in your head anymore that you have a prosthetic in your mouth, and it just becomes more natural. And I can taste food better, I can chew better, I can talk better, I can whistle louder than I'd whistled before. Everything is just amazing. If you're here, you're obviously starting this journey and you're looking into it. And all I can say is I want you to feel what I feel. I want you to take all that trauma, all that pain, all that anxiety, and throw it away. And I want you to feel this life that I feel, because it's an incredible life. Life just gets better. And I went on vacation and met an old high school friend, and she was like, man, something's changed about you. And I'm like, yeah, my teeth. And she's like, no, it's not just teeth, it's just you. And I'm like, yeah. I know, because I'm happy. It's because of my teeth. So it's just changed my life. It's given me this confidence I've never had before. And because I've lost my teeth at 17. So grown up and all those important years, meeting people, dating, all that stuff, I just never really had the confidence. And now I do. And watch out, world, because here I am.